We have excellent relationship. We have agreement to have sessions in the meetings of the American Heart Association and American College of Association, but also they have joint session here in our meeting. So we invite representatives from these important societies to be part of our meeting, and I think it's quite important that we try to work together to tackle the burden of cardiovascular disease over the world. So I think that we are using in the future the same drug. We are working in a very nice atmosphere and a very good spirit in terms of advancing together in research. Of course, and that's unavoidable, we have the very positive competition in terms of providing the best result and the best science. But I think that the European scientists are quite keen to go and present their research in the American meetings and to publish their research in the American journals. And on the other side, I know now that the American scientists are keen to present in our hotline their hot topic, since they are ensured that they will have a perfect visibility, since that the studies that are presented in our meeting get an additional chance to be published in very important journals, such as our European Heart Journal, which is getting an impact factor over 15, so just behind the Journal of American College of Cardiology and a little bit above the circulation, which is, I think, excellent. Presenting the science in our meeting raises interest of publishers of Lancet and of New England Journal of Medicine. So I think that we have a mutual agreement in collaboration, and I think that we have a very positive competition. I think that cardiology in Europe is not uniform. We have so many countries coming from, you have a gradient from northern to southern Europe and to western to eastern Europe, not in terms of quality, of course, but in terms of practice, and we cannot have, our goal in Europe is to get a uniformity and to harmonize the access to the best healthcare in the terms of cardiovascular disease. So maybe this is one of the differences between United States, where I think that the healthcare system is relatively harmonized, and where we don't have to, where probably the cardiologists have not to discuss extensively how they can implement the guidelines, because there are not so many shortcuts in the support for delivering adequate care to the patients. In terms of innovation, I think that we have a lot of innovation recently that came from Europe. If you consider, for instance, the innovation in the term of implantable aortic valve, for instance, the TAVI, the two first valves were designed by European people, and even more, I'm very proud of it, by French people. I was working with Alain Cribier at that time, and I was in his team where he implanted the first aortic valve. So the strength of the American people is to have the possibility to set up huge study and to bring a lot of information coming from this fantastic study that they are able to do within the country. But I think that the comparison between the two countries, we are getting more and more close, and in terms of recommendation, we are also discussing very much, with few differences, of course, but this is the interest of having a different society.